Thank you. And if we move to the next slide, Angela, sorry. So our we always start our meeting with vision, purpose, and policy priorities. And if you're new to us, welcome. And as I said earlier, thank you for moving through the new policies that we have to further lock down these meetings. Please feel free to share it widely, but we are asking you to pre-register. Our vision is to be able to have connected health data that is a standard across California, and that not only are Californians able to easily access their information, but their providers and caregivers are able to as well. We are a multi-stakeholder coalition that builds supportive policy for this aim. And our policy priorities that we'll be updating for next year currently are to focus on cementing funding, which we have been able to do successfully this year and look forward to, doubling down next year. We also are and have been really following the data sharing mandate, resulted in AB 133. And we believe that we need to have, all equal across the state and not have any white space that does not have the ability to connect. And then finally, this work that we're doing to be able to really follow state activity very closely so that we all can do our best to keep that in our line of sight and that progress is being made at a rapid rate. Next slide. And our 7 ingredients to data exchange, this was a blog that we posted earlier this year, but it has really been a guiding light for us of how we approach our programming. And this is where we are constantly looking for new research, new projects, new bright lights that we can bring from other states or within the state and share that here. And you will see as we have collected your feedback that we are going to be doing some doubling down on not only governance and enforcement, but also with really looking at consent, privacy, security, and identity matching. So we also highlight, I keep losing my voice today, sorry about that. But we are also using 2 priority use cases to drive our work. And that is, again, another area that you'll see a lot of our emphasis, including the workshops that we just sponsored around homelessness as well as the aging. And now we're working with WIC to be able to provide a summit early next year. But it's really around how do we combine and engage social services and also public health. Now the next slide. Do we have our guest of honor?
She's just trying to get on Zoom, so we need just a couple more minutes. I think let's move forward with this section, Timmy.
Okay, that sounds great. So Robbie and Amy, I'm going to hand it over to you, and it sounds like I should to save my voice.
All right, sure. I'm going to go first. So these are the priorities for 2023 that we talked through at the last meeting. So the block on the left was that was all content we went over last time. And then we added to this based on what we heard in the last call. So in terms of policy priorities for next year, oh, sorry, Angie, you go back up. A couple of things that came up in the call last time, which is just sort of something to keep in mind as we're doing this work, is that it's going to be challenging to bring on additional signatories. And this is when we were talking about the non-required. And Lori mentioned that KHI is working with one county as an example, so we'll be able to learn from that. So we added that to these slides as we're sort of thinking about our planning for next year, keeping that in mind. Okay, next slide, please. In terms of programming, some items we added from last week based on the conversation, thinking about how we'll manage data by and get consent by categories, questions about like where HIPAA ends, how the various categories of data are defined. It's all a little bit ambiguous based on the comments last week. So that's something we'll be keeping in mind for next year. Thinking about how individual access to data impacts the work that we're doing. Thinking about how we can incorporate feedback from the HIMSS interoperability and HIE committee, as well as from the care quality meetings. And I think Marilee Benson mentioned she's involved in those and might be able to help get us connected in with what's going on there. So next slide. In terms of new participants to try to include in the coalition, there were a lot of ideas that came out of the last meeting. San Mateo County, including more CBOs, more county representation, public health representation, more 211s, EMS, Medi-Cal managed care plans. So we got a lot of ideas out of this group. And also, I guess if people have other ideas that they want to bring up today, raise your hand and we'll be happy to add those as well. So we're sort of going through these. Or you could put it in the chat too. So opportunities for 2023, a couple of new ideas out of the last meeting. These are sort of around work group possibilities. We'd like to do work groups again next year, potentially one with Cal-Ain County facilitators, potentially a work group around the role of caregivers. Let's see this CWDA, we can add that. Thank you, Daniel. Any other feedback on opportunities for 2023 that people want to share? All right, next slide, please. So this was our final list of policy priorities for 2023. Data sharing, getting the data sharing agreement executed and kind of supporting that effort next year. Advocating for funding to support this work, figuring out how to integrate social services data, and then just like policies and procedures around the data sharing agreement that this group could support and sort of provide input on those. Any thoughts on anything that we might be missing? And then sort of the next steps that we're taking on based on all the feedback that we've received. We're planning to talk to Marilee, she's here, but about like kind of get more input from her on some of these meetings that she attends and how we can kind of integrate that content and learn from that. Talking to Gary Madden about involving more 211s. Jim, I think you offered to kind of help us with some public health rep outreach. I think you specifically mentioned ASTHO and APHA. Dan Chavez, hopefully get some help from you. We'll be talking to you about how we can incorporate EMS representatives, and we are planning to develop some kind of a tracker. We're not sure what it's going to look like quite yet, to keep track of who and how many organizations have signed the DSA. So we'll be monitoring that and letting people know kind of where that stands next year.
Yeah, and I'll jump in, Deanne. Yes, we expect, the state has said that they're going to make transparent the organizations that are signing, but I think we can do a lot to be able to think about it as more of a dash or like a heat map, I guess, or dashboard, to be able to kind of zero in where there is pockets of folks that may or not be signing, so we can elevate that and prioritize that. So I think that's what we're thinking about. And then in addition, and I think we have this as part of our programming today, but Connecting for Better Health is part of the education grants that CDI just released to be able to help with the data, educate stakeholders around the data sharing agreement. And because of that, I think one of the areas that we have is this idea of rewarding and celebrating those that do sign. And so if we think about maybe a medal or a sticker, some kind of digital sticker that can go up on websites. So that's another way for us to, I think, really be part of the process.
All right, great. Well, thanks. I think so. Next slide. I think that was all for that. Do we want to go through this now?
There it is.
Yeah.
Yeah. And just thank you, everybody. Again, this is our feedback to you that we heard you, and we're excited to kick off and running for next year. If there are other areas that you think we're missing or is not reflected here, please follow up with us. We would very much appreciate it. And thank you for all of your input. Robbie, what's the status?
She is just creating a Zoom account. So hang tight, Timmy. I think let's
Okay.
proceed with our other content for now.
Okay, wonderful. So as I just mentioned to you all, CDII awarded 8 educational initiative grants. Super happy to relay to you that Connecting for Better Health is part of that first multi-association initiative that is being led by America's Physician Groups, APG. It also includes the California Academy of Family Physicians, PBGH and their California Quality Collaborative, the California Association of Healthcare Facilities, the California Association on Area on Aging, and the California Association of HIE. Many of you have been part of this work and are represented here today. Thank you so much for joining us and joining forces. And for those of you also, I see a few organizations that are also represented here that are among other grantees. Yeah, I think the state just had a meeting and a kickoff meeting today, and there's an intention for us to collaborate and to work together. So we look forward to doing that. Any comments or comment as we kick this work off? Okay, yes, Dan, I think we have to unmute you.
Yes, thanks, Timmy. Any sense of who the California Association of Health Plans is using to do this work?
I didn't hear anybody speak on their behalf this morning. Instead, it was CAHP. I don't know if anybody on this call is working with CAHP or knows. We approached CAHP to be part of our collaborative and or part of our work, and they declined.
I'm just curious as to who they might be using. That's really leverageable for what we're talking about. I just think as much as anyone, it's obviously disappointing not to see the California Hospital Association represented.
I noticed that as well.
Given that only 50% of our hospitals are connected today. So but thanks for sharing.
Yes, the American Academy of Pediatrics lists their hospitals as part of their stakeholder group. And I would say there's one other that listed the hospitals as part of their group as well. See, there's some questions in here. Is any awardee focused on social services agency? Well, we are through the areas on aging. And also, I think if I go back and look, and there is a deck that was shared, I think it'd be, it's shareable that we can send around to everybody. But the Leading Age California Foundation also lists social services as part of there. And, I was actually really happy to see the County Health Executives Coalition to be part of it because of the work that they do with counties. Terrific. All of these awards are going to start in the new year in January. And there's just a lot of programming that all of these associations are including in their grant, including boot camps, health IT conferences, webinars. We will be offering office hours in addition to work groups and workshops and webinars, and then also a speakers bureau that'll be available to be at all of our associations and their meetings and their conferences. So we'll be kicking off at ITEP. If all of you want to say hi, we'll have a table at ITEP as well to talk about the DSA. So we're off and running. Deanne, you just asked us to repeat something. What was that you wanted me to repeat?
Can you hear me?
Yes.
Did you just say that, because this is a component I wondered, did you say that like the state team will be available to these awardees to present?
Oh, the Speakers Bureau. We'd like to be able to include the state. Yes, that is we wrote that in that we would collaborate with the state, but we're also looking for individuals
Got
all
it.
of you that would want to be available to present and be at conferences, and to be able to help extend our reach. So that's what the idea of a speakers bureau would be. Okay, fantastic. I see, Christine, you've been able to conquer the Zoom gods today. Let's see if we can hear you. Are you able to unmute?
To me?
Yes.
Oh my goodness. Okay.
Let's take down the slides and hopefully we can pin Christine.
There I go. Oh my goodness. I have it the right way too.
Thank you so much for joining us today.
Of course.
And we have a great group here to be part of this discussion. And as we set it up, it's really a fireside chat, a real one with two of us, or in between two ferns. And if I had the background, I would put it up, but I don't. But I really welcome you. And for those of you who don't know, Christine Mapile is our representative as the California State Assembly Health Committee. She staffs that committee and is assigned to Health IT and everything HIE, and has been just tremendous leader for us over the course of the last few years, and really was very close to the sausage making for AB 133, if I can say that. And Christine, I just want to open it up if you want to make some introductory remarks about your role, and we can go from there.
Sure. So my name is Christine. I'm with the Assembly Health Committee. I would say that my policy areas with respect to the committee is predominantly health insurance. So I do cover California, commercial market, some of the affordability bills, not the Office of Healthcare Affordability, but really looking at the premiums. So that's kind of my main thing. I got into the health information space a couple of years ago. I also do privacy, so I think it was a natural thing. We, up until a couple of years ago, we weren't really focused on health information. I would say that Dr. Wood really started to look into it first in the Medi-Cal space. So that's kind of our introduction. And of course, as Timmy alluded to, we did have a bill a couple of years ago, just right before AB 133. And in that bill, it was 1131, I think that's the number.
Yep.
Dr. Wood had authored a bill to really establish a statewide kind of database. And it was really meant to address some of the things that he was seeing with respect to COVID. Vaccine information, public health information. So that's really where the conversation started. And that's where, Dr. Wood is really focused on. So that's just kind of, high level what we, some of our background with respect to health information.
And can you give us some insight of how you evolved from 1131 to 133 and where and how the compromises were made?
Sure. So our bill 1131, it was held in Assembly Appropriations. So really early on. And, I will say that the discussions, we had so many discussions because even before we introduced the bill, we had a number of informational hearings to really kind of level set for us and especially for members, and to identify some of the gaps with respect to health information, to identify which organizations do this, where in the state there's this thing called white space, this idea of pushing information. So really for us, it was kind of level setting even before 1131, getting members up to speed. And when we introduced 1131, a lot of stakeholders had, I would say, opinions with respect to how that should be developed. And luckily, our goals were aligned with the governor's, because at the same time, the governor introduced budget language, identifying some of the concerns and some of the kind of goals with respect to health information. So we were very pleased to see that at least through budget, that the governor and his administration continued that work in, our common goals, continued that work in 133. So, I know that a lot of people have been involved with 133. I know there's still more discussions going on, but, ultimately we are very supportive of the goals of the administration.
And I think on that line, it's a great way to go in terms of what's next for 133. Do you see that it's done, or that there's going to be need for additional, legislation and or regulation and or
Yeah.
else? I don't know, in your world.
Yeah, so I remember taking a look at the framework. I think it was released or the agreement that was released in July. I know a lot of people had many opinions with respect to the framework. I know that, it's considered a framework. Even though it's a contract, it's considered a framework. The terms and conditions of that framework, as everyone knows, still needs to be kind of, ironed out and detailed. But, we're hoping that everyone comes into compliance, I will say, and signs the agreement, because ultimately we are supportive of the administration's goals. So I know there's plenty to do. I know that, I'm hearing that the administration is thinking about some language. There needs to be cleanup there. I know that, there's enforcement issues. So, we would hope that everyone complies. There's like these encouragements also that, other entities should sign the agreement. So, we hope as all the stakeholders that are identified in the framework, they comply and they come in and sign the agreement. And I hope those that are encouraged really think about that, they should come in so that we get this information that we really need. So the other thing that I will talk about is budget. The thing that we last year, while 133 was being implemented, Dr. Wood had supported a budget proposal. So to give money to not only medical providers, but also the infrastructure above the medical providers to connect. So, we were hoping for something like that. I think some money got down to the level of the medical providers, but not up here to the information organizations that would compile the information. So, I know there's still work to do, but, these baby steps we're really excited for.
We are too. And I think maybe we could just step back just a little bit around what we're seeing in Medi-Cal and education and just really big investments in helping in public health to be able to stand up, better data insights. And I'm wondering is, from your perspective, from Assembly Health, which is really kind of issues, where and how do you liaise with those, and how, is there a role for the coalition perhaps to be able to help kind of weave this all together?
I missed that last piece, Timmy.
Yeah, there's two questions in there.
Yeah.
So one
I'm
is just
sorry.
how do you kind of interface with those other big, let's just ask that question. How do you interface with those other investments and think about that? And then I'll follow up with my follow-up question.
Yeah, so I hear what you're saying in terms of, there's a lot of different information that's being collected by the state in terms of here's education information, here's social services information, for Medi-Cal, as you alluded to, housing information. So this is kind of what Dr. Wood was talking about, right? Not only public health infrastructure, getting the information that we need to address health equity, health disparities, even quality of care, but also to tap into, I know that there is an organization, I forget what it is. I wish Scott Bain was here to join me, but early on in our conversations, there wasn't a organization that it was able to address food insecurities, housing. So those are the kinds of things that, we hope that ultimately 133 will get to. Know that it's baby steps now, know that we are first focusing on medical information, right? But of course, we know that medical information translates to health equity and other aspects. So I'm hopeful. Of course, we're super involved because we see bills all the time, but we always like to think about this bigger picture, right? How does it connect to 133 and where that ultimately will take us in terms of, okay, finally we will have something that will be able to address holistically health and all these other social related issues.
I think that's really good news. So for us to think about when we see all these kind of disparate
Mhm,
initiatives,
mhm,
that we kind of make sure that we highlight them to CDII potentially to help kind of bring all this together.
mhm.
Really great insight. And I think my follow-up question is around the coalition. We've been tracking anything and everything data sharing. So in addition to the data sharing framework and data sharing agreement, we're very keen in looking at the investments that Medi-Cal is making for population health, for example, or looking at where there's going to be hopefully some major investments in public health. And I'm wondering, your thoughts on how the coalition can be even better, I guess, about
Hmm.
what we're doing and how do we help you?
Yeah, so I think again, it's all about education. We did, a series of hearings, informational hearings.
Yes,
I
I remember
don't know.
that. Thank you.
Yes, and I don't know, to what extent we're going to do that again, because we just did that, right? So we have our information on our website with all the background and stuff like that. I just think that, to the extent you get to new staff, to new members, and kind of prep them for what's coming, whether it's with respect to new budget information or new bills that members are carrying. I think that would be super helpful. We are only, it's just our committee staff and we have other issues, but I think to the extent that the staff gets up to speed, because everyone post-COVID knows that collecting this information will be really helpful, but I think for them, they need to really understand how does that impact them, impact their constituents.
Well, hearing you loud and clear on that, and would welcome some follow-up there on how we could do that. But I know we just went through an election process too. So on that side, that there seems to be a real influx of new members. I'm wondering if you could give us some kind of like lay of the land of how should we be thinking about next year?
Yeah, no, I don't know. To be honest, it's a huge amount. And so even us as an office, we're thinking about how do we help to welcome these members and get them up to speed on the landscape of California's healthcare system. And it's just going to be really complex, but that's kind of what we do, is to give them the background information. And to
That is out of your office.
Yeah, and to the extent that, we have stakeholders behind us kind of filling in the gaps and the details, that would be, super helpful. I think it's like 30 new members, at least on our side. I don't know on the Senate side, but,
Wow.
Of course, you want to focus on both sides, right? But, getting the word out there, telling them that 133 is even out there, that it's still in the implementation phases, there's these key dates that they should be aware of, because they're going to either hear from the providers that are signing it or from patients, the information that's being shared for them, and then also the value of that to their constituents. So really kind of focusing on that, because I think, identifying the real world challenges for for members and then for their constituents, I think is going to be helpful.
And you just mentioned Senate Health too. What relationship is there and how should we be thinking about Assembly and Senate?
Yeah,
basic question.
Yeah, and they're getting a new chair. Now, if you know who that's going to be,
We haven't heard,
please
no.
let us know. But so there's that thing too, right? We don't know what the priority of that chair will be. But luckily the staff is still there. They're really good at, especially with respect to the Medi-Cal space, I would say Dr. Pan was really attuned to collecting information to help with disparities. So luckily the staff is there. His bill, unfortunately, didn't move forward last year. I think it was vetoed by the governor, but at least at a staff level, they know and can identify some of the concerns. And so hopefully the chair that will come in will take on some of the same goals. But I think, again, with the new member, depending on who that new member will be, there's going to be some level of education. And then again, we don't know who the committee members will be as well. So
When will we know?
I don't know. Hopefully when we come back in early January, I don't know. even when I talked to Senate Health last week, nobody really knows. There's, just names being thrown around. So I don't know. So it's going to be a new chair, probably new committee members, the new membership on the Senate side, at least for us on the Assembly side, our staff is a little bit more well-versed because we had those, again, going back to the informational hearing. So we have kind of that background there.
And you said
But
those are videoed and they're up on your
yeah.
website.
Mhm,
Right,
mhm.
we can link to those.
Yeah, and then I would say too, in addition to Senate Health, budget, always having that discussion with budget, because 133 came out of budget, and so budget staff is always someone you should loop into.
Any other committees that you would highlight too?
On our side, privacy, maybe sometimes some of our health information bills go to privacy as well. They're not as involved, but sometimes it touches on that. But really it would be Senate Health, budget, and then of course leadership. So Speaker's office and the Pro Tem's office.
Great.
And Marjorie is attuned to all the Medi-Cal issues. So it's good for, she's there, she knows what the issues are. And then
Go ahead.
and then Mary Adair, she's the new Speaker's health person. Well, not new, but she came in kind of towards the end of the ledge season this year.
Fantastic. We will reach out and make our invites as well as our introductions.
Yes.
Are there any bills that you're watching in this area for next year?
No, I have actually not heard anything. And, a lot of stakeholders with respect to 133 have said that, probably the administration is going to have some language with respect to the board and giving them, some of their authority. I actually haven't seen anything. I haven't seen any kind of language. I haven't heard any budget proposals at this point. Our Assembly budget had issued a blueprint. I think that's what they call it, a blueprint, kind of identifying some of their priorities. And really the priority for the Assembly, it seems to be, is kind of maintaining what we have now versus looking at new spending. So those are kind of the things that is happening, at least in terms of budget discussions, but I haven't heard anything. I know that some organizations are continuing to look at information as it relates to health equity and disparities. Again, it's specific to, like, for example, mental health. So those are kind of the things I'm hearing, but that's specific to, treatment, diagnosis. So but nothing kind of at the overall 133 space.
Fantastic. Well, we'll keep watching those too. Any of the bills that are of interest around accelerating data sharing, we will support
Sure.
or at least look at and understand where there's areas of support. I'm going to open it up for questions. I haven't seen any come in through chat. Christine, the Equity Coalition that ran some language for infrastructure budget for the health information organizations that Dr. Wood sponsored. Felix said thank you for that.
Mm-hmm.
I don't know if that's going to come back around this year.
Yeah.
It could. Anything else? I'll open it up. Dan, did you want to ask a question? You need to be unmuted.
He is unmuted.
Okay.
Thanks, Robbie. Hey, Christine, thanks so much. One of the biggest struggles that we have in making data sharing happen is this divide between health and human services. Is there any work that you're aware of to break down some of these challenges, at the county level, at the state level, between health and human services? It is just so hard, right, to really make things happen when even within the same county, you have these two departments within an agency that won't share.
So those are the concerns that we've heard for a number of years now. I will say that it's encouraging that the framework says encourage is in there, and that so many people are, as I know, there are so many stakeholders that are participating in this kind of stakeholder process. I don't know, Dan. It's just such a complicated issue with respect to privacy and mental health information and county councils. I don't know.
It's more the county councils, really.
I know.
We
I
can
know.
manage the technology. We can manage the privacy. I am confident in that.
I know.
People want to do
I
this.
know.
We
I
need some
know.
help. It takes
I
so
know.
much time, money, and energy.
I know. It's about the trust and secure. I know. I've heard those issues before. I just, I don't know.
Whatever we can do, Christine.
I know, Dan, I don't know. I mean, we had that issue with our DHCS bill, right? Because
Yep.
the bill was with respect to the mild and moderate, severe, and then the severe, and just the two entities not talking to each other.
Right.
And we heard during those discussions, we can already do that. Well, then, but it's not happening, right?
Right.
Because yeah,
We are wasting so much of this great Calais money,
I know.
right?
know.
So much of that is just going to waste on
I
this
know.
one issue.
I know.
Okay.
I know.
I'll be quiet.
I'm like,
I know. Any recommendations you have? Anybody that we should be talking to? Happy to do that.
so door is opened.
Yeah.
Wonderful. And I think that with the data, I mean, what I'm hearing too is we can point to the data sharing agreement.
Yeah.
And Dan, as part of our work or our grant application for next year, we are going to be holding office hours with an attorney.
Yeah. Oh, good.
So, perhaps we can start making sure there's peers can refer other peers into having the same language and vocabulary and go forward.
Right. And the flip side of this may be sort of a backdoor with the ask me form for consent. I mean,
Right.
arguably, right, if we get some
Right.
momentum there,
Right.
this is a way to address that issue, which
Right.
puts the responsibility on individuals,
Right.
right? And a lot of agencies to get consent, but that would be a way to handle this.
Yeah. And I will say, Dan, we are seeing a lot of more consent issues in the privacy sphere. So that's kind of why I mentioned Timmy, and those types of bills go to our privacy committee as well. So it's us and privacy committee.
Yes.
So.
Yes, and I'm seeing the chat right now. And Christine, you may have missed as I was going through the priorities of the coalition for next year. We're hearing loud and clear. We need to double down on consent. And I think that the DHCS pilots gives us a way to be able to say, here's a start, maybe you have to use your words in another area, but what can we do? What can we learn from that? Where can we learn more sophisticated approaches, which we know we can do? So I think that's an area that we would love to work with you on.
Yeah.
I don't know what it would cost to do a study in the state of California to research the cost and the lack of care given by this one issue. But I think the dollars and the human impact is astronomical. And I don't know how much it would cost us collectively to do a research study in the state of California.
It's a great point.
Maybe the Blue Shield Foundation, wink, wink, could help us with this, because this is really, in my humble opinion, one of the biggest inhibitors that we have in providing good health and wellness in our state.
No, I agree, because you don't have that information and we won't be able to access that information. So we have an incomplete picture. I get it. Yeah, totally.
And I am looking to see if there's any other hands raised or questions for the chat. Okay, seeing, oh, Katie, thank you. Do we have to unmute you?
Yeah, I think to follow up to Anne's point, I think really, and I put in the chat as well, is looking at potentially funding this kind of, for those that want to try this, because I know in Alameda County with the SHE, they've tried to address some of this. So
Mhm.
as part of these pilots, really kind of design this, fund this, show and build that trust at the regional level, because that's what I really have to look
Right.
at, building at the regional level and versus the state level, because every state level we've gone forward with has failed. So I think really bringing it down to the region, because like to Dan's point, we have super agencies at county that kind of, they don't have these barriers versus other counties, you have the separation. So I think really looking at these different types of regional structures and funding pilots around that so that we can design these pilots at the regional level.
And local governance with is where the trust is.
Exactly.
I'll add that. Thank you, Katie. Okay, well, Christine, thank you. Thank you so much for joining
Thank you.
us. Thank you for, again, your leadership, Dr. Wood's leadership. We really look forward to building upon this relationship next year. And I think, our door is open as well. So if there's anything you need feedback on, or you would like for us to, galvanize and pull together perspectives or organize the troops, we're here for you. So
Great.
yes, thank you so much.
Thank you.
Have a happy end of the year and restful few weeks, because I'm sure you need to take that time and get gear up for the new year.
As we all do. Yes. Thank you.
All right, take care. All right, everyone. Robbie, I'm going to hand it back to you. I think you have some updates for us. Angie, if you could put the PowerPoint back on, that would be great.
Yeah, and thank you to Christine for joining us. I think just a couple other updates. So in addition to announcing those education grants that Timmy mentioned earlier on the webinar earlier this week around the data exchange framework, they went through again, how to sign. It's super easy. You can access the portal through the Cal HHS website. They will also be hosting a signing portal town hall on January 6th, where folks can log on, sign in real time, get some assistance, which I think is great. And they also laid out a couple of dates too around QHIO designation. They're hoping by February to have the application for QHIOs up and running, and then by May to announce who the QHIOs are based on that. I think in the meantime, we're still awaiting a draft PMP on the QHIO criteria. So we'll keep our eyes peeled for that from Cal HHS and CDII, because they'll need that to be able to let folks know who.
Robbie, that's going to be a very quick turnaround, I would think, if there's going to be a draft and then an application to be posted in February. So we'll likely need to make sure that we distribute that out to everyone.
And we still haven't seen that out for public comment yet either. So I think
we may, I would love to just put it out there. We may want to have a one-off meeting to review the qualified HIO with all of us, if it doesn't fit in our time frame next year.
Yeah, I think that is a follow-up I have on my list, just to see when I think this is writ large with the PMPs that are outstanding, is when we'll be able to see those draft PMPs and provide comment on them, because so far we also, as the public, didn't receive the drafts that were reviewed at the meeting today. Which to that point, we will have more of a summary of today's policies and procedures subcommittee meeting at our next meeting in January. There was spirited discussion around information blocking today and what does real-time data exchange mean, and on some other issues too around transaction patterns, a lot to unpack there. So I think we'll hold off on debriefing that until January, when we can kind of review our notes and such. But just moving to the next slide. Just a reminder, you can sign the DSA. Here's the link in the materials. January 31st is the deadline for those organizations required under AB 133 to sign. And just on the next slide, we wanted to go over just a couple recent, exciting proposed rules that have come out of the federal government. So this first one is from OCR and SAMHSA related to 42 CFR Part 2. For those of you who deal with behavioral health data, know that 42 CFR Part 2 often can be seen as a barrier to sharing data. So, the major proposed change under here per the CARES Act from Congress, which, required OCR and SAMHSA to go through this process, it would allow substance use disorder patients to provide a general one-time consent to a provider to share their data for all future uses and disclosures, which, is a big advancement. Currently, patients have to provide consent every time a provider wants to make a use or disclosure. There are a couple other items in there too that really are meant to align 42 CFR Part 2 with HIPAA even more, just changing definitions, allowing for civil monetary penalties and the like. If you're interested in reading that 200+ page behemoth of a proposed rule, you can check out the Federal Register. Comments are due on the 31st of January. I think as a next step for us, we would like to write comments. I see Timmy nodding. That will be on my to-do list next week. I think if folks have any thoughts or suggestions, please send them our way. We'll share a draft, obviously, in early January and solicit input. Have I read it all? I'm halfway through, but so I think in general, I think the sense is that we'd be supportive of this change, and the more minor changes too. I think harmonization amongst the various laws is always great. And that this consent provision, I think still recognizes that we need additional consent and protections for substance use data, while also balancing the fact that we want to make sure that these data get shared when they need to. Anxiously awaiting my summary. Me too. So we'll make sure to share that once we have it. Any thoughts or any questions folks have?
Yeah, I think as a coalition, next step is the summary, and then we will have a good discussion at one of our next meetings in January, capture that discussion as comments and submit those by January 31st.
Yeah. And then just on the next slide, another proposed rule that came out. This one's only, I think, around 100 pages, so a bit shorter. But this one's around prior auth coming out of CMS, and it would affect MA organizations, state Medicaid agencies, Medicaid managed care plans, and QHPs on the federally facilitated exchanges. This has been in production for a while. Some of you may remember at the end of the Trump administration, they put out a proposed rule and asked for comment with like 14 days. So the Biden administration came in and they put that on hold, at that time. And now we're seeing the new proposed rule, which has come out, which, I think a lot of stakeholders are happier with this version. Just a couple proposals in here. One around the patient access API rule. They want to make sure that they expand the requirement to ensure that plans also need to share prior auth data with patients as well. Now there's around the provider access API, similarly to also require that to include prior authorization information. And just around the payer-to-payer API, expand the requirement to share data when patients switch plans to include claims, encounter, and prior auth data as well. And then within prior auth, there are several, additional rules that CMS would like to impose here, just around prior authorization requirements and documentation and decision, create an API for that. Denial reasons would need to be shared with providers, a specific reason for any denial around prior auth. They're proposing timeframes of 72 hours for urgent requests versus 7 days for general. CMS is also asking, do we need tighter timeframes, to get back to providers around prior auth? And then just around MIPS and for critical care hospital or critical access hospitals to include an prior auth measure, in there too, which is kind of cool to see that, baked into the promoting interoperability, formerly meaningful use measures too. And then there are at the end several RFIs as well, where CMS is asking for more information about quite a few things. Some of the highlights are in here: adoptions of standards for social risk data, exchange of behavioral health information, and around advancing TEFCA as well. So whether CMS needs to provide more incentives or mandates to join TEFCA. And yeah, agreed. I think prior auth would be a great way to reinforce the data exchange framework. I think, the initial reaction from both payers and providers is that folks like this rule. Previously it left out MA, which I think was a big gap. And, we were waiting for all the other interop rules to take effect. So I think it's good timing. And, similarly, we'll put together comments for this NPRM as well. They're not due till March. We have 90 days for this one. So we have a little more breathing room. We'll get through the P&Ps and 42 CFR first, but would also love to open it up if folks have any initial thoughts. Are you as excited about prior auth as maybe we are?
I can sense the excitement coming through the screen.
Awesome. Well, okay, just a couple other items to share with folks. So on the next slide, we just wanted to share a couple other items here. So today there was a PMP subcommittee meeting, as I mentioned earlier. A lot to unpack there. So I think we'll let it all settle in and revisit that in January, which will be a good time to, in terms of just reporting out on the next implementation advisory committee, which is on the 20th next week. And please note in your calendars, our first meeting of 2023 will be on the 12th at 11. We'll have a method for signing up for those meetings implemented, hopefully next week. So keep your eyes peeled for a roundup. We'll have it in there. And just a couple other items. So the National Academy of Medicine released a discussion paper on health technology for all. It's kind of focused on health technology and patient access and equity writ large. So there's mentions of patient access to records, telehealth, but I think, there's a clear HIE connection there too. This Sequoia project put out an implementation guide from the data usability work group. So that is out there too. Our very own Timmy was quoted in a recent article in EHR Intelligence. I would point to a specific quote, but there's a lot of goodies in there, so check it out. And the FTC and several other federal agencies just released this really cool mobile health app interactive tool for developers to figure out, based on what they're trying to create, where various, federal laws are implicated. So that's out there too.
I just put the article in the chat. I received some comments over email, and one of them said, "Timmy telling it like it is." So yeah, can't help but do that. So enjoyed seeing it come out in print.
And it looks like the National Public Health Law, or the National Public Health Law a group is going to also have an OCR review in January of the proposed rule. So would love to coordinate Daniel on that work too. Yeah, the tool's a little late. I agree, but better late than never, right, Jim? So it's out there for folks to use. And I think with that, if we just move to the next slide, that is it for us. Timmy, I'll hand it back to you to close this out for the year.
Well, thank you again. What a great conversation. We really, really appreciate having Christine on today. And we did reach out to a few of the other staffers too, including those that she mentioned, and they had some conflicts today. I think it's a really busy time of year. But they did indicate that they would be welcome to join us in the new year. So we will take advantage of that when they have some downtime, because I think it's really helpful for us to hear what their priorities are. And my big takeaway is that she hasn't seen anything yet. So that's pretty interesting that we can file away. Yes.
Real quick, it might be good for some people in this group to present to them. Like,
Oh, yes. And that wasn't even in the prep of asking her, as well as the others. There's a real need for education for staffers. And I think she said that, as well as we've heard it in other settings. So Connecting for Better Health will be reaching out to create a series that we can rely on all of you to input for that. So, or be inputters and speakers. We'll follow up on that. But I'm looking forward to it. I think there's a lot of opportunity there. And of course, we'll be sharing our fact sheets, and lots of that is a lot on our new website when it goes up. So there should be a lot to be able to highlight. Yes, happy holidays to everybody. I hope that we all stay healthy and enjoy being with your families, and squeeze in some downtime. And if you notice, we do have our new calendar schedule. So we really encourage you to download those for the new year. And if you have any problems, or if you hear problems of being able to register, let us know. Hopefully we got this all wrapped up. With that, thank you. Have a great day, and we'll see you in January. Take care.
bye.
Thanks, everyone.